Well, good evening, everyone, and welcome to our health condition workshop on fibromyalgia. And my name is Paul.
And my name is Bev. Good evening.
And hi, Bev. How are you?
Paul.
You're sitting a little tall there. I can't see you there. I have to. No, the other way.
Way.
There you go. That's it.
Perfect.
So we're going to do something new today. You got Bev and Paul, but today it's Paul and Bev, and we're going to do our workshop on fibromyalgia. A couple of things with this one is, first of all, if you would like to download the workbook to go over that we're going to go over a little later, you can do that sometime during this presentation, and you can go. We got it there, justtouch.com/workbook, and you can for free download that workbook and put it on your computer, and you can follow us when we go into the second half of the program to teach the points. And also, there's a little donate button there on your screen, on your Facebook screen. We don't charge for these anymore because we've closed our Tucson Center for a while until we can open it after the pandemic. And so anything you can do to help us keep this show going and keep the center going and keep the teachings going is greatly appreciated. So, Bev, I had to interview Dr. Tiffany Hodges
Wow.
the other night, and I think what we'll do is like we usually do. We're just going to let her present, and then we'll come back on and teach the points on how to work with fibromyalgia. Yeah?
Yes, perfect.
Okay, here we go. Welcome to our BioTouch Health Condition Workshop on fibromyalgia. We're doing something a little different this time. We're interviewing Dr. Tiffany Hodges. Hi, Tiffany.
Hi.
And she's stuck in Albuquerque, so we're doing this a few days before, but we're just going to let you take over and introduce yourself, what you do, even tell us a lot about what all those little letters are at the end of your name, okay?
Okay. So my name is Tiffany Hodges. I have a doctorate in physical therapy. I'm from Maryland. So in terms of the letters behind my name, basically I'm the first are just the physical therapist, doctor of physical therapy. OMPT just means orthopedic manual physical therapist. So like when I originally started doing PT, I was focused on sports medicine, manipulation, that sort of thing. And then I got into pelvic floor therapy and became a certified lymphedema therapist. So yeah. Anyways, we can go to the next slide, but I'm going to talk about fibromyalgia today. And so just to give you a little basic information about it, it's a musculoskeletal disorder, kind of like it says on the slide, and you can have it triggered by many things. So you could have physical trauma, surgery, infections, any sort of sickness can trigger it, psychological stress. But most of the time, from what I've seen in the clinic, people get it for no real reason. So one of the big things I look at with that is with fibromyalgia, it's like a accumulation of stress over the entire body over your lifetime. And that's why you see it diagnosed in middle age, because people are older, their bodies have compensated. Yeah. But women are more likely to get it than men. And women are often misdiagnosed, which I'll talk about more later, whereas men are usually not diagnosed because it's not like really seen as a good thing for men to show their feelings or show their pain, and they're supposed to like be strong, right? So most men don't even talk about it. So I think that's part of the variance in numbers. And then they've seen like a genetic component, but I'm not going to really talk so much about that because that's not my physical therapy area. But yeah. So basically with fibromyalgia, you'll see a lot of decrease in function. People have more and more increase in pain, sensitivity. They're not as able to do things like daily living activities, getting around the house, walking, anything. So they have more hospitalizations, depression, suicides. It's also linked to rheumatic conditions. So osteoarthritis, rheumatoid arthritis, muscular, like MS, lupus. EBV is Epstein-Barr virus, and there's conflicting information on that. And then you've got people with PTSD, ankylosing spondylitis, like all these things I've listed here. The lymphedema, lipedema, you don't see as much in the literature, but I see that a lot as a lymphedema specialist, that they get diagnosed with fibromyalgia because their skin is so hypersensitive. And when you have a lot of like lymph fluid congesting your tissues, it's stretching everything out. There's a lot of waste products that are trapped. And so they have pain everywhere as well. And then that also comes along with like obesity. But anyway, so all of these conditions have similar things in common in that they all have pain everywhere. So then it makes you wonder with fibromyalgia, and this is where the whole misdiagnosis thing comes in, do they really have true fibromyalgia, or do they just have other conditions that are making them hurt? And then if you think about like how many injuries they've had over their lifetime, like you could have people that have had whiplash and neck pain, back pain. They've like torn their rotator cuff, sprained their ankle, gotten patellar tendonitis over decades. So now you have all these separate injuries that are pulling on each other because the whole body is fascia. Fascia covers everything and connects everything. So every single injury that you have creates a pull in wherever that injury is. And now you have all these different pulls pulling in all directions. So fibromyalgia actually is a fascial pain syndrome. It's not just musculoskeletal. Okay, let's go on to the next slide. So yes, the symptoms. So widespread musculoskeletal pain, stiffness. You see, kind of like I was talking earlier about how there's a big decrease in function, where patients just like aren't able to exercise as much anymore. They're in too much pain to do anything. And as a result, they get weaker. And then they get stiffer. They're having more pain. The more they can't move, the stiffer they get. Which I forgot to say on the last slide, hypermobility is another one that's often linked with fibromyalgia because people that are hypermobile have too much motion. So their bodies are actually tightening more to try to stabilize them, which creates a similar fascial pain pattern. But in those cases, they're not actually stiff. If you check their range of motion, they're very mobile, but they feel stiff. So like, you know, doctors have to listen to those patients, even though they look like they're very mobile. If they're complaining that they're stiff, it's because it's not their normal. They actually are stiff because their fascia is in so much pain. But anyways, back to fibromyalgia. So the fatigue is a big thing because they're not sleeping well. They're in too much pain to sleep. So they wake up a lot during the night. They're tossing and turning. So that causes the fatigue. It causes the fibro fog or brain fog, where they're having memory issues, hard to remember, hard to focus and concentrate. And then when you're not getting enough sleep, it causes your whole body to tighten. So like all your muscles and fascia tighten even more. And so then you've got this host of like headaches, migraines, temporal mandibular joint disorder or TMJ. The tinnitus is like a pulling on the eardrum. So they're getting ringing in their ears as part of this. They have more anxiety, depression, painful periods, interstitial cystitis, because the whole pelvic region is becoming painful and tight. So you have to look at all these different systems. So when you're looking at the abdominal region tightness, you're going to have digestive problems. There's bloating, pain, constipation, irritable bowel syndrome, and gastric reflux. But a lot of that is because the intestines have become so tight that everything's not moving correctly. So you're trapping waste products, gas, fluid. Yeah. And then the tingling and numbness has to do more with like nerve tightness. So the nerve fascia itself can get tight. So if you think about fascia being everywhere, it covers your intestines, it attaches it to everything. It covers your arteries, your veins, your nerves, every structure. So literally you can do fascial work and treat all these different structures. RLS is restless leg syndrome. So they often have that where they're getting pain in their legs and feeling like they have to move. They can't stay still. And then Raynaud's is more of like a coldness. So they're not getting as good circulation. So if the arteries and veins fascia is too tight, then it restricts circulation to the extremities. So they're more likely to have cold hands and feet. And then dry eyes and mouth, skin sensitivity, rashes, dizziness, vision problems. I mean, all of those are actually pretty associated with visceral issues. So when your digestion is not doing well, then you're collecting toxins in your body because you're not getting them out. So everything gets more sensitive. Yeah. So overall, you have the decreased function and frustration. And then a lot of the times they're shuffled from doctor to doctor because people are looking at them and they're like, oh, well, you know, we don't know what you have, because fibromyalgia is diagnosed by exclusion. So that means that you basically have to get tested for all these other things to make sure you don't have any of those other conditions. And if you don't have them and they're like, well, you still have all this pain. And I believe there's like 18 points or something. And if you have at least 11 points on the body of pain, then they're like, well, you probably have fibromyalgia.
Amazing. Amazing.
Yeah. So in that sense, you've got very frustrated people that don't know what's wrong with them. They're just in a lot of pain. They haven't been to anyone that can help them. And a lot of doctors, if they're not used to dealing with that, they may say, well, you need to go see a specialist. You need to see that specialist or this specialist or somebody else that can help you, or like go to physical therapy or go to see any of these other like alternative medicine doctors. And then you have to hope that you've been sent to somebody that actually has experience with this condition. Because honestly, in mainstream medicine, like what I learned in school was, you know, you do aerobic exercise, gentle exercise, strengthening and stretching, and teach people breathing and meditation techniques. And that's it. Like you don't do hands-on. But the fascial component of fibromyalgia is so important, you can't leave that out. So if you have somebody that's only under that mindset, you might go to physical therapy and that's all you get. And you're like, this doesn't help. Like I'm trying to exercise and it's just making me hurt more. Let's go to the next slide. I think I may have started to move on. Anyway, so yeah, so the standard PT is like that. And so if you have somebody that is in too much pain to exercise, then you... Oh, how can PT help? Sorry. I think I moved on before I moved my slides.
Okay, we're with you.
Yeah. So if somebody's doing all this exercise, even if it's super gentle, they can still have pain aggravation from it if the exercise is actually fighting their fascial tension. So like, for example, somebody that has poor posture, let's say they have rounded shoulders, they have a forward head posture, and you're telling them, okay, you need to squeeze your shoulder blades and straighten up. And so they're like this, and they're like trying to squeeze, and I'll turn sideways. They may be rounded and they're trying to squeeze, but they're still in this forward posture because they're stuck. They're being pulled down by their tissue. And they're like, it hurts to try to straighten up. It hurts my low back. It hurts my neck. Well, of course it hurts because you're fighting yourself. So then if you actually do hands-on first and release the different fascial adhesions that are pulling them down, all of a sudden they get up and they're like, oh, I can stand up straighter. It's not a chore, because it's not how strong their scapular muscles are at that point. It's that they're not strong enough to fight the front. Does that make sense?
That makes a lot of sense. This is great.
Yes.
Tiffany, great.
Once you've opened up, then you can start strengthening because you're actually in a better position to strengthen. Okay, so what did I say here? What have I found in the clinic? Severe fibromyalgia symptoms versus misdiagnosis. And I talked about that a little at the beginning. But basically, when I see somebody with severe fibromyalgia symptoms, they're the people that are super hypersensitive to touch, and they can only take very gentle touch. And that's where something like BioTouch can be really effective, because those patients, when they go to like a massage therapist, it may be too much pressure for them and they want it to work. They want to feel better, but their nerve endings are literally on fire, because what fibromyalgia does to your nervous system because of this chronic pain is it makes the central nervous system become sensitized. So your brain is actually amplifying your pain. So normal things that shouldn't make you painful are starting to get more and more painful. And so you really have to down-regulate the nervous system. So when you do gentle touch type things, BioTouch, craniosacral, very gentle visceral mobilization, anything like that, your hands are introducing such a gentle touch that the nervous system can be like, oh, this isn't hurting me. And then the nervous system goes, okay, maybe I can let go. Maybe I can calm down and like let this person work on me. And a lot of this is subconscious. The patient's not thinking this in their head. But if you go to somebody and you just start working on them and their subconscious is going, I'm scared, I've been in pain for so long and I've been tested and prodded and everyone's hurt me, they don't know, their subconscious doesn't know whether you're going to hurt them too. So in a way, it's also called you're getting consent from their subconscious to be treated. And I know with BioTouch, you're doing that. You go in to somebody and you're getting permission to work on them. You touch them and you're like, okay, like, I'm just going to put my hand on you. Is it okay? And then their body starts to relax. So that can be really good. Versus with misdiagnosis, and I see this a lot as well, I have patients come in and they're like, oh, I'm diagnosed with fibromyalgia, but they're not sensitive to touch. They're not hypersensitive really at all. They're just in pain. So in those cases, those people have widespread pain from multiple injuries sustained over their lifetime. And everything hurts because it's just getting pulled on in every direction. In those cases, like, they may not actually have fibromyalgia. They're just diagnosed with that because they have pain everywhere. And they're going to respond better to treatment anyways because they don't have the central sensitization of the nervous system. So basically, let's see, I skipped ahead. The techniques that I use, I put on here. CST is the craniosacral therapy. That's more addressing dural tension, like of the spinal cord and the brain. So basically, your central nervous system is surrounded, it's covered in this fascia that attaches it to the skull. So you can actually feel the skull bones, like you can put your hands on them and you can feel the motion of the tight fascia. You can feel it pulling to where it's tight, and you can treat through that system. It's very gentle. So it's easy on people that are hypersensitive. Visceral mobilization works more on the intestinal fascia, the pelvic organ fascia. So that helps with like pelvic pain symptoms, incontinence, anything like that. And it also works the lungs. So sometimes people will have neck, chest, and back pain that's actually because their lung fascia is so tight that it's restricting their rib cage. And so they can have pain with breathing. Or it's so tight and the diaphragm and the intestines are so tight that it's putting pressure on the vagus nerve, which causes nausea. It can cause vertigo, headaches, so many different symptoms because it's a huge nerve that innervates everything. So neural manipulation is another technique. I forgot to write that down, but you're working on the fascia of the nerves itself gently. And then strain counterstrain is the SCS. And that's a shortening technique where you're shortening the tissue to allow it to unwind and release versus trying to stretch it or pull on it. So when you shorten something, it takes away the strain. So it's a less painful way of addressing things. In some of those deeper structures, like if you're working on like the phrenic nerve, for example, it's running through the chest. The only way you can really get at it is to compress the rib cage up and in. So you're using the lungs and the diaphragm to shorten the nerve. So you can actually release the nerve that way without ever touching it. So MFR is just myofascial release. There's so many types of myofascial release. Technically, all of this is working fascia, so it's considered myofascial release, but the myo means more the fascia on muscle versus this is fascia on all different systems. And dry needling pretty much just addresses muscular pain and gets tight muscles to release. I found it to be very effective for fibromyalgia. Most of the patients I've had come in with tons of trigger points in their muscles because they've been guarding so much. But then you have to think about, with anything myofascia and muscular, is what are they guarding? Because you can treat muscle as much as you want. You can manipulate the bones, massage, trigger point release, dry needle, whatever. You can treat all that and it will release. But then if you haven't addressed what's causing it to guard, it will just keep coming back. And then once the fascia is looser and they're able to move better, then I start adding gentle exercises. So then I'm going to be like, okay, let's start doing active range of motion, but only to your tolerance. Because if they have central sensitization and you're like, okay, go stretch this, go move in this direction, their brain already thinks everything's going to hurt. So if I'm like, if I tell them to like turn their head and do like rotational exercises, and normally when they turn their head a little bit, they're like, oh, that hurts. So I'm like, don't go that far, because as soon as you set off the pain again, your nervous system goes, I was right. This is going to hurt me. I'm going to guard again. So you don't want to set off a guarding response. So you're going to go, okay, move, do really tiny yeses and nos, very tiny motions slowly in a non-painful range. And when you start to feel more relaxed, slowly add a little more range of motion. See if you can tolerate it. If you can't, back off. It's okay. Because as your brain gets used to you moving a little bit, it'll start to let go and stop guarding as much, and you'll be able to regain your motion. Balance exercises are another great way to get the stabilizers working, because you're not actually moving. You're just trying to hold your balance, but it makes all of your stabilizers have to kick in and work. And it can be really tiring. But again, everything has to be to your tolerance so that you can build your strength and endurance back up. And then basically get back to normal life. So we can move to the next slide. So this slide, I just kind of have a list of everything I could think of in terms of alternative therapies like that helps with pain. And another thing that's on here that I forgot to mention earlier, what I use for treatment, is somato-emotional release. So there's a huge component of emotional trauma, whether it was part of what caused the fibromyalgia or because of them having it. So sometimes people can have trauma in terms of like the worst would be, physical, sexual abuse, emotional abuse. There's childhood abuse at any time, any of that stuff. It causes the nervous system to tighten and sets you up for something like this. But you could have other emotional issues in terms of like you had anxiety as a child, you had stage fright. Somebody made fun of you. It could be as little as that, or as little as like you were a baby and you fell down the stairs, and then you carried this fear afterwards subconsciously for the rest of your life. So it can be micro trauma or macro trauma, but when you have any sort of emotional related trauma, it can be stored in your tissues. And people that have had traumatic experiences with trying to get medical care also have emotional trauma related to people not understanding them, being made fun of for their pain, people telling them it's all in their head. And all of that can also get stuck in the tissues. So one of the most...
let me ask you with that. So is that getting to the root cause, what we're guarding, some of the trauma responses, and even they're finding out cultural trauma and DNA trauma, like we bring
Yes.
from generations. Is that
Yes.
getting to the cause?
Yes. But just remember, it's not always the cause.
Yeah,
like
yeah.
some people,
Right.
it came after the fact.
Sure.
But yeah, if that's the root cause and it is generational, it has to be addressed. And what I found is people that have really, really bad, like physical symptoms that are not responding to anything, it's usually because it's an emotional block and their body is just guarding and holding that area. And once you get that emotional component, everything starts to unravel. It's pretty amazing when it happens.
Yeah, wow.
But you can't force it to happen. So you can't just go to somebody and be like, I want an emotional release. Like they can't make it happen. It just happens. And then the practitioner has to facilitate and help you through it and help you to process. Yeah.
Perfect.
Yeah, I guess that's pretty much it for now.
Yeah.
Unless you have any other questions.
There's for all of you some of the contact information. That was awesome, Tiffany. I mean, I'm just like overloaded with information, and I'm sure everybody who watches this will be Thursday night. You can all contact Tiffany. We'll have information for you. But thank you so much for doing this. This was a great little taping, recording, whatever you call it. And we wish you all the luck with your new job there in Albuquerque.
Well, I'll be back in Tucson too, so I'm just here for a COVID span of time.
Okay. Well, we look forward to seeing you when you get back.
But yeah, it was so wonderful. Thanks for having me.
Okay, thanks, Tiffany. Oh my gosh, folks.
Wow. I've got lots to say.
Yes. So we had lots of people, Eileen and Jenny, Lynn, people, giving their ideas. If you have questions, put them in the comment section, and we'll get them answered or send them to Tiffany. But now that slideshow, I will be sending it out with this whole video in that email. If you're not on our email list, go to justtouch.com and just sign up for that free ebook, free preview, and that'll put you into our email list. So when she started talking about BioTouch and the release of the fascia, I was like, oh my gosh.
Now, it kind of came to me, and it was just like, you can't force things to happen to get to the cause, but that's exactly why BioTouch works.
Yeah.
Because it's in its own body's timing.
Yes.
BioTouch helps that.
Right.
Isn't that amazing?
And she talked about hope, I mean, how many times have we said BioTouch brings you hope?
Hope.
Yeah.
Yeah, I just wanted to say something. There's a very important person in my life who's been diagnosed with fibro. And when Tiffany was talking about the emotional trauma, it came out when her husband passed away.
Wow.
And some other things came up, and boom, there it was.
Wow.
And she's actually kind of related the two, but of course doesn't know what to do, doesn't know how to do it with allopathic measures. So,
and again, that's what we love about BioTouch. Our whole purpose is to encourage people to grow in self-awareness.
Right.
And just that light touch allows the onion to unpeel to where you come in your own time. There's nobody pushing you. And then when you're ready to do some of this deeper work or physical therapy, you go to somebody like Tiffany. I mean, there's plenty of people who are working with this situation.
Wow.
I told you you'd love it.
I know. It's awesome. It's wonderful.
So what's important for us here is to teach you some sets of points to do. Again, if you go to justtouch.com/workbook, you can get the free for 30 days. Get that for free. If you're a member, you can get all the workbooks. What we're going to do is this new little format. I'm going to be the techie over here. And we're going to let Bev take over to do the teaching, and you'll see her pretty face, and you'll just hear me in the background. So we're just going to start teaching you the points. So let's go right to the manual there.
Okay.
Whoops, wait.
The greeting is always performed at
There, okay. You're on.
I'm on. So, well, we usually have a cover page that kind of goes into what the condition is that we are presenting, but I think Tiffany did a pretty good job on helping us with fibromyalgia. So why don't we go to page 6 of our manual and let's get started. And at the very top, what is BioTouch? This is a very simple technique and literally can address all concerns, all health conditions. The most beautiful thing about it is that tonight we're going to give you the few little things that you can learn immediately, and now you can be very effective with it. So let's just kind of go through these bullets real quick, and then we'll actually talk about the technique itself. So BioTouch is easy to learn. We know that. Children, we've had children become certified. That's really how easy it is to learn and then practice. When you learn BioTouch and you practice it, you will immediately be effective. That's just the crazy part of this amazing technique. This is meant for every one of us. So that's why it has to be this way. It's a complement, as we're beginning to realize. This is a holistic system that addresses the body in its many different layers and aspects. That's part of that self-awareness that we're always talking about. It's complementary, but it's also integrative with all healthcare regimens. Whatever you're doing, if you work with somebody like Tiffany and you're doing BioTouch, it's so wonderful. If you do chiropractic, if you want to do a diet, if you want to work with your allopathic physician, all of these are perfect with BioTouch, because BioTouch is just going to enhance whatever it is that you want to do. And this is where BioTouch encourages you to do what you need to do, whatever that may be. So it's a very non-invasive, very beautiful accessory to whatever it else is that you or your loved one is using. The wonderful thing about BioTouch, there are no levels of ability. Yeah. This is another reason why it's meant for every one of us. You don't have to go through, as it says, special training. There's no hierarchies. There's no initiations of any kind to be able to learn and use BioTouch in your life with anyone else. And again, you're immediately effective. I don't know too many other amazing techniques that can say that. But again, this is not meant for just the few. It's meant for the many. It's meant for every one of us. BioTouch, no special preparation, no belief system is required. Your state of mind, well, as Paul says, you could be having the most terrible day of your life. You reach out and you touch someone and boom, it has nothing to do with that. So there's no preparing a space, no preparing yourself. You don't have to shield yourself from another member of the human family. You just touch another human being. There's nothing, we're separated enough in our little egos and personalities. BioTouch is here to bring us together. So a belief or a state of mind, no. Preparation, never. You just want to help another person in their suffering and their pain. That's it. So those are the basic things about BioTouch that we always want to share with you. And now I'm just going to show you how easy it is. 1, always wash your hands before performing BioTouch, using BioTouch. It's one person touching another person on the skin. That's the definition of BioTouch, one person touching another person. And that's very, very important. We're doing some things right now in the scope of what we're all dealing with, the pandemic. We're not being able to be close to each other. And so we're kind of saying that there's some other ways that you can use BioTouch effectively. People always ask us, well, can I do those points on myself? Well, as you're going to find out, there's many of the points you can't reach on yourself. We don't know if it's effective or not. But again, bringing it right back to what BioTouch is two people in a relationship. You see those two fingers? One person, two persons coming together, touching. So you begin every session, as you're going to find out real soon now, the greeting. You use the first two fingers of each hand. You lightly touch the skin as a butterfly, very lightly. In fact, the lighter you touch the skin, it's like the louder it is for the body. It's this gentle, loving, beautiful touch that the body goes, wow, okay. Very non-invasive.
That's
right?
like what Tiffany was talking about in relation to the fascia, just that light communication. And I think the best word is just that loving touch will help the body relax and heal itself.
I'm telling you, that is so right on. That was just beautiful, because we know that that's true with BioTouch, and here it is. Light butter-like touch, the lighter the touch, it gives the body that ability to, as she was saying, just in its own timing. This is so wonderful. I just think it's so wonderful. Then when you touching, you want to hold each touch for 6 to 8 seconds. And that's it. Wash your hands, two fingers, lightly touching on the skin, holding for 6 to 8 seconds. I'm sorry, there's no more. That's it. That's as beautiful as it comes. So now that we have a basic understanding, you've been given the technique. That's the technique right there. We're going to address some specific sets of points that you can use to help someone with fibromyalgia. This is the beauty of these workshops. They are designed to be specific to a condition, and there you have it. So, Paul, are we going to see the first video?
So the first one is the greeting.
On the greeting.
And as it says there, this is always performed before you do anything else.
This is what you always want to make sure. Even if you just do the greeting, you're going to start something. You're going to open the body for something. So that's the one thing you must do before doing anything else. Do that greeting. It opens the body. It begins. It's the key. I don't know what else to say. It's precious. It's awesome.
All right, let's just show it.
Let's do it.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same two fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Okay, you're on.
Wow. So as you can see, here's this children and family members, mom and dad. So let's move to the stress set. And of course, as Tiffany was talking about emotional trauma, stress set is really going to be able to address those things. Anxiety, of course, when the body is all locked up in the muscles and the fascia, we have stress and anxiety in the body. So this is a great set to use to help the body to really relax and open up.
The stress set may be used to address any manifestation of physical, emotional stress, as well as anxiety and shingles. Hold at X, which is in the fleshy area just below the bottom of the breastbone. It is the same as greeting point 1. Then with the other hand touch points 1 and 2, which are the same points as in the heart set. These points are found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this imaginary line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. These points may be touched repeatedly, and remember to touch each point for at least 6 to 8 seconds.
Okay.
Okay,
Got it.
great. Okay, let's move on to the next set, a very important set, the metabolism set. This just helps the body to rid itself of what it really doesn't want and bring in and integrate into the body what it needs. So as we always know, the body knows what it wants and how to get itself into a wholeness. So this is a really great set to use for fibromyalgia.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
And there we are with the metabolism set.
So I just wanted to remind people, for those who are new to BioTouch, that what you're looking at is our manual. This is our workbook part of our manual, and we've only taken out a few sets of points that you'll need. But just so you know, there's always the drawing with a description of what the points work for. There's also a little link. You see that in purple there. That little link takes you to that video that you're seeing. And then on the next page, always just opposite, is a description of where the points are. And those words that you see there are exactly the same as you're hearing in that video. And again, on that page is also another link to that same video. So very easy to learn. You can download this from our website and learn it at any time you want. So
Yeah, yeah. Yeah, it's a very simple, again, very simple instructions to follow, diagrams and explicit language that takes you to those points. So it's a great manual. Yeah. So let's move to the headset. I remember Tiffany talking about, when the body is in pain, things start locking up, and that definitely has an impact on, our thinking process, our sleeping, depression. I've talked to a lot of people with fibromyalgia who have what they call foggy brain. So there's a lot of these things that the headset can definitely address.
yeah, she also talked about, remember where she said that the you get the body to move, but it has a memory of hurting, and
Yeah,
this is a perfect set to help break that.
right. Oh, well, BioTouch, the perfect thing to help break it up, isn't it? Yeah,
Yeah, let's break it up. All right, let's show
that old
this here.
stuff. Yeah.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use ThruFire to touch points A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead, where the forehead begins to curve to the crown. Step 2 is performed in crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In crossfire, touch point 1 above the outside corner of the eye on the ridge. Point 2 above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. Point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. And point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, 2 and 2, 3 and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
Okay.
Yep, there's that headset. That's amazing. Okay, now we're going to look at what's called enhancements in local work. And, you know, the fundamental, the basic technique is those 17 sets of points. But the practitioner, we're always given another opportunity to do a little bit more work in an area, specific area, to enhance the effect of biotouch in that part of the body. So Paul's going to show you the video, but just know that for fibro, because there's pain in all these different parts of the body. I know a lot of people end up with arthritis, and you can actually go to that part of the body that is being affected by that. So this is a very wonderful opportunity, an extra way to help.
Yeah, and even if they just do the greeting and some of what they're going to learn here, just local work, if all you have is a few minutes.
Exactly. It's great. Yeah.
All right, here we go.
Enhancements in local work may be performed anywhere extra attention is needed due to disease, pain, infection, rashes, broken bones, cuts, or unusual growths. For example, local work could be performed in an area where there is an unusual growth such as a mole, cyst, or tumor. This area may be touched using any combination of matching fire, Then proceed with any local work or enhancements. Allow yourself to experiment with the different touches you've learned, and you will always touch the right point. Remember, you can't
hurt anybody.
You can't hurt. You know, I wanted to say after listening to this, the part of the video that doing local work and addressing the extremities, especially in situations like with fibro, when the whole body, there's all over the body, there's these things that come up, is just the most amazing opportunity to do specific area healing for somebody. It's just wonderful how you can, just on the other side of doing the actual set of points.
Yes.
But then you get to open up and have a little bit more opportunity to do even extra deeper work for them. I just find that so wonderful.
And I think what's important here, we're both on now. I think what's important here is you don't have to do a lot. I mean, we've given you the basic sets of points. If you just do the greeting and a local work, or the greeting and even A&A in the head, but get that manual, and it has links to the video. If you have any questions, you contact us at justtouch.com, office@justtouch.com. Download the workbook for this one. You get 30 days for free of this if you're not even a member. Pass it on to your friends and your family. You can do this in front of the TV set. You can do it, after dinner, before bed, out at the pool. It doesn't matter. You can just do it anywhere. And we've just seen, I've been doing this for over 30 years, and I consistently see people get relief. If that's all we're doing is a little bit of relief, that's the hope, I think, that Tiffany talked to us about.
Yeah.
That's when the healing can begin, is this, the mind starts to relax and the body relaxes with it. The cells start talking differently, and it just goes
going
on.
to the cause. You're going to the cause. That was so wonderful what she said, and I find that so true. You have to go to that level, and the cells, it is at that DNA level, right?
It is.
The body knows, and it knows BioTouch.
It knows BioTouch, and we love sharing BioTouch. This will be sent out to all of you. You can forward it, pass it on, link up to whoever you want. We're just trying to freely share BioTouch with all humanity.
Yep.
Bev, that was great. That was awesome. That was an hour. We did great.
That was wonderful. Thank you for asking me. I guess I'll be doing this with you now, huh?
Yeah, it makes it a lot easier for me. Just have to work in the background.
Well, I've gotten my feet wet now, so
yeah.
I'm good.
So we look forward to seeing all of you next month. We're going to talk about postnatal care, postpartum care, and otherwise show up every Monday with Mondays with Bev and Paul. Go to our website. We have also a virtual training coming up. Sign up for that. We'll see you all real soon.
You will.
Love to y'all.
Bye.